Salmonella is a bacterium that causes salmonellosis, which is a common disease that affects the gastrointestinal tract. It is a gram-negative rod-shaped bacterium that is a facultative anaerobe and part of the Enterobacteriaceae family. In the genus Salmonella, roughly 2,600 serotypes have been identified, and most of them can adapt within their animal host, even in humans. Serotype is a group within the single species of microorganisms such as bacteria or viruses, which share distinctive surface chemical structures. This bacterium usually lives inside humans and animals and is excreted through feces. The two most common ways humans get infected is by the contaminated food and water. Salmonella enteritis is the most common serotype of Salmonella in Europe, accounting for 87% of clinical isolates. Despite the improvements of sanitation and hygiene, Salmonella infections continue to increase in both developed and underdeveloped countries across Europe. Most of the symptoms you'll have from a salmonellosis infection will be stomach related. These include stomach cramps, diarrhea and bloody stools, fever, headaches and a stiff stomach. Even most symptoms usually don't last over a week. In some cases it can take several months for your bowel movements to get back normal.
Occasionally people who get a salmonella infection experience pain in their joints. This is known as reactive arthritis and can last several months or even longer. If you get this joint pain, you also could develop pain while urinating. Dehydration commonly affects people suffering from a salmonella infection due to the diarrhea-like symptoms. Signs of dehydration include urinating in small amounts, dry mouth, and sunken and dry eyes. If the salmonella infection gets into your blood, it can infect your body's tissues such as tissues surrounding the central nervous system, the lining of your heart, and the blood vessels surrounding it, and your bones and bone marrow. These infections can lead to serious diseases. There are some general procedures / recommendations used when treating gastroenteritis, which is a severe illness in children. Some general recommendations include to give plenty of fluids. Oral rehydration solution is recommended and can be found at most pharmacies. Fizzy drinks and cordial should be avoided. Medicines preventing vomiting or diarrhea should be avoided unless instructed by your doctor. Small portions of food should be given, but to avoid foods high in water or fat, high in sugar or fat. There are many different things that can be done to prevent the spread of infection. The following are some methods used. 1. People with salmonella infection should be removed from childcare, school and work until there is no diarrhea for 24 hours. If you work in the food industry, it should be 48 hours. Anyone who has salmonella should not go swimming until there has been no diarrhea for 24 hours. Meat should be cooked thoroughly. Any meat or eggs purchased should be checked to see if clean, within date and or cracked. Follow good food handling and hand washing procedures when